92% of patients are dissatisfied with their current financial arrangements for dentistry. Dentists' hands are tied, and this has limited the best possible treatment for the patient. Damaged patient and dentist relations due to non-payment or late payments. What is the solution? DenCap is the solution. DenCap can now provide a specially designed capitation plan modelled for South Africa's unique requirements.
DenCap basically started when I came back from England to see friends of mine dentists, and they told me that there's problems in dentistry financing wise and for the patient and for the dentist, and asked me to look into what is going on worldwide and what can be seen and what can be implemented in South Africa. I was looking at the UK, where I was working in certain practices with different sorts of financing methods, and also in the new NHS, that is basically a capitation scheme. New, everybody in the world looking at that, and maybe South Africa, future National Health will implement that as well.
DenCap is a capitation fund and not a medical aid. It's private dental aid, top-up of your medical aid, financing for dentists. What types of capitation models are available? So how does it work?
Worldwide, preventative medicine is the way forward. National Health in England and also America's health systems look at preventative medicine. So preventative medicine must be incorporated in South Africa system, either dental or medical. So in the process of looking at what is currently happening in the UK, preventative medicine is the buzzword there, and it is a working model. So we came up with a solution of a capitation scheme based on international models that works, and from there on we invented or devised a system for South Africa specifically for our problems.
DenCap determines the dentist's hourly rate, the fee structure for each practice, the yearly fee escalation, and the data supplied to monitor risk factor of patient base. We also supply the quarterly data profiles to practitioners, study groups, corporate clients, year-end comparison data and peer review. What will it cost the dentist? No capital outlay. Software supplied and installed free. Software training free. Helpline for dentist and personnel. Free helpline for patients. If dentists embark on this process, what support does DenCap provide? Consulting and training, staff training to administer new plan, hands-on help with the conversion to capitation. Set up peer review groups, a call centre, a helpline for dentists and personnel, broker support if needed. Why should dentists be looking at the DenCap model? DenCap gives the dentist the chance to implement the practice's hourly rate into their fee scale. DenCap manages the plan, but every practice stays independent. The practice will have an even and constant cash flow stream. DenCap's plan is for the mutual benefit of the dentist and the patients. Control of implementing clinical decisions. Restoration of trust. Restoration of the goodwill value of a practice. Patients all dentally fit over time. Reduction of time spent with high-risk patients. And part of the cutting-edge dentistry in South Africa. This model works on the following assumptions: 2,500 active families per practice, a turnover of 180,000 rand per month, the comprehensive plan of 350 rand per family per month. Initially, the dentist must aim to convert 10% of their patients to DenCap. This creates a large portion of your fixed costs every month for 12 months of the year. This 10% equates to a DenCap income of 72,600 rand per month. Next, the dentist must aim to convert 25 to 30% of patients over a period of time. 25% in DenCap will bring in over R180,000 per month, the same as your current turnover. The other 75% of patients will bring in a further R135,000. 30% will increase your turnover from the current 2 million to a staggering 4 million.
DenCap has now devised a specific plan for South Africa's specific needs. It's based on preventative dentistry, and it will bring in a proven plan for the patient's benefit, and for the patient it will give peace of mind, and for the dentist it will help him with a steady cash flow and income.
So there you have it. Contact DenCap today. We'd be more than happy to assist you in planning the future of your dental enterprise.